Welcome back to NYA Talk. I'm Elroy with Jeremy right here in Class Hit Country, AM 1310 and FM 96.1 KGLB. Jeremy's adjusting the mic of our guest here, so
Hey,
I was looking at that.
We got to introduce our guest. We're now pleased to be joined by Tim Jopp, the Medicare man. How you doing today, Tim?
I'm doing great, Jeremy.
Everyone's heard that tagline if you've been listening to the station. You know, it's a busy time of year. We're going to spend the next 15 minutes or so talking a little bit about that busy time of year. And, you know, again, this isn't necessarily, Tim will be the first to tell you, this isn't a promotion specifically about Tim, but we know we have so many listeners right now that are going through Medicare open enrollment. They're having to make adjustments, and, you know, we just want to kind of get down to that. But before we get into it, welcome back to the program, Tim. Always great to have you, and thanks for joining us. Kind of busy for you, so you're taking some special time away from your duties to join us.
I am, Jeremy, and thanks for having me. You know, I appreciate you guys calling me and having me come in. I really enjoy this time because it is a busy time. Just to give you guys a little heads up, we talked to, over the next few weeks, we talked to over 3,000 Medicare members and about their plans and what they should do and how they should make changes and help them out through that process.
One big thing, you know, too, is seminars that you're holding. Let's talk about your seminars and what they're about, and how can you enroll, or how do you get into it, or just listen to your programs and get seminars, because that's important to older people.
Yeah.
Just say younger people. I was going to talk like Jeremy on that one.
Yeah, so we hold seminars throughout the whole West Metro area, and you can go on our website, timthemedicareman.com, little plug there, and sign up for seminars through that. And we do seminars. We hold a couple of different kinds of seminars. We do product-specific seminars, so where we talk about just one specific company, or we also talk about 101 seminars, right, where it's just learn how Medicare works and what it does for you, and how do you sign up, when do you sign up, when should you make changes. And in those seminars, too, on the 101 ones, we actually do Social Security, too, on when should you take Social Security? How should you take Social Security? We bring in an expert for that. And what makes that fun is we actually have an attorney on retainer in Milwaukee. I know it's Wisconsin. Sorry, everybody. But she does a great job on giving us a second opinion on when you should take it. And it gives people the peace of mind that they're doing the best thing for their Medicare and the best thing for their Social Security.
You know, when you talk about these seminars, and we mentioned we can find it again, timjopp.themedicareman.com, but you said in the entire West Metro. I know just the other day, I think earlier in the week, you were over in Arlington. So just so people are understanding, maybe talk about some of the communities that you're in, because people might think, well, he's not out by me, or you're probably doing a seminar within 10 to 15 miles of just about every one of our listeners out there.
100%. Yeah. So Belle Plaine, we've got seminars in Belle Plaine. We've got seminars in Chaska, Chanhassen, Hutchinson, Glencoe, Arlington, Waconia, Delano, I'm sure. I mean, we're all over that area, your listening area. So we've got everybody covered. And we're actually doing one. We did one in Arlington earlier this week. Yesterday, Jeremy, we did one in Minnetonka.
So
it is getting around.
You know, seminars all over.
You know, one thing, Jeremy doesn't get this, thank goodness, but I get them. And Joyce out the next room got some. Scams. What do we do with those? And I sometimes get 2 or 3 a day.
Yeah, avoid them. That's the first thing you do. But you can't. The problem is they get your information, and they're relentless. So a couple of tips we always tell people is make sure you can, the person you're talking to is legit. Don't give them any personal information. If they're asking, we just had a client got taken for $10,000. That's a lot of money. And the thing they got taken on is gift cards. They made it sound like their grandson was in trouble, and they had to go get these gift cards and then read the gift cards over the phone. So then they have control over that. Then they also transferred money. They got into their bank account because he gave them some personal information. They transferred money from his savings into his checking, and they said, look, we overpaid you. You got to pay us that back. He didn't know they transferred it. So he said, fine, take that money back out. And there was $1,500 taken out. So you've got to be careful of if somebody's in trouble, if somebody needs your help right now, or you have to do this now or the police are coming, you got to be like, no, that's not legit. One of my favorite ones was a client got a call and said, if you don't pay us now, we're sending the cops. And he goes, good, send them now because I'm getting threatened.
So what do you tell someone, they're going through this process, and obviously, we look at, they're trying to take advantage of people. That's ultimately what it comes down to. And some people, I don't even want to say are gullible, but it's just in your good nature, right? That you're thinking, oh my gosh, I've got to help here. If people are suspecting that they might be scammed, or if they're questioning something, boy, this just does not add up. Something doesn't seem right. What's the first thing they should be doing?
You know what I always tell people? Get their phone number. Say, hey, can I call you back? I'm busy right now. And most times they'll hang up and not take, they won't answer that. They won't give you a phone number back. The other thing, we've got a good resource through the Better Business Bureau where they basically have a cheat sheet of what to look out for getting scammed. So you can call our office. We can get you that information, or you can go on the Better Business Bureau website.
Tim Jopp, the Medicare man, he's our guest here on Norwood Young America Talk. We said he's the Medicare man. That's been his moniker, TimTheMedicareMan.com. And, Tim, tomorrow, Saturday, October 15th, or today, if folks are listening to us on Saturday morning, it's a big day because it starts Medicare open enrollment. As we go into this time, maybe just some tips right from the start, because we're going to go over a lot, but what should people be looking for? What should they be doing right now?
Yeah, first off, you got to look at what's called your ANOC. Everybody should have their ANOC by now from their insurance company. ANOC stands for Annual Notice of Change Coverage, right? Annual Notice of Change. That basically tells you what your plan is changing. Now, not all the information's in there. So sometimes we get calls saying, hey, is this no longer covered? It's not in my book. The only information that's going to be in that book is going to be your changes to your plan for next year. So you want to look at that first. Second thing you want to do is, has your prescription drugs changed? You've got to look at your prescription drugs, and you want to shop it with basically all the carriers that you can and make sure you've got the best plan for those prescriptions. That's what we spend most of our time on. It's not necessarily the plan designs. There is some differences in plan designs this year, some big changes. But the first thing you start off at is your ANOC, and then your prescription drugs is second. And there are some changes, especially in McLeod County.
Well, as long as you brought that up, let's talk about McLeod County. Why is McLeod County different than the other counties?
Yeah, so when you see those commercials on TV, right, check your zip code, that is true. Counties do vary on what they offer. So a plan in Carver County, just to give you an example, one plan in Carver County is it's going down from $99 down to $73. In McLeod County, it's $99. It's going down to $97. It's just how they file their plans with the state or with the federal government. So you're going to want to look in McLeod County. There are some significant changes. Most plans, a number of plans are going up this next year in McLeod County. We have a few that are going down a little bit. And we have one specific one that is going down like $22. So it's a big decrease. And the benefits are actually getting better on most plans.
Go ahead, Jeremy. You've got a question. I can see that.
When you talk about, Part B premiums, talk a little bit about those, because off air we were talking about Part B.
Yeah, so Part B, remember, you pay a premium. Part A is free. You don't pay anything. That's your hospital services. Part B is your doctor services. And there's a cost with that. And Part B, this year, it's $170.10 for most people. It's actually going down. We haven't gotten full confirmation, but we're pretty positive it's going to go down to $164.90. So that's actually a good thing, right? It's going down. I know it's only going down a few dollars, but at least it's going down. Now, if your income is over a certain threshold, so if you're like, well, I don't pay $170, I pay a lot more than that. That's if your income's over a certain threshold for a single person or for a family, you actually pay more than the $170. And how the government determines that is they actually look back 2 years on your taxes. So the call we get in February is, hey, Tim, last year I paid $170. This year I'm paying $340. What's going on? And I know right away that they probably did something. Their income spiked 2 years ago. And it could be farmer sold some property or sold some land. That spiked their income. They transferred money from an IRA into a Roth IRA. You had to pay taxes on that money during that time period. So that just for that year, then their premium would spike for Part B and then actually go down the next year if your income goes down the next year. So that's kind of a general thought on what is happening with Part B this next year.
You know, and I think it's important too that people don't just, you know, sometimes we get so comfortable and we just stay status quo, right? Everything, you know, you're talking about plans where you have an opportunity to save anything. Well, every one of us in this room, driving by the station right now, out there in listener land, they've seen inflation the last year. They've seen increases in gas and groceries and all of those different things. And when you say, well, you know, it might only be 10 or 12 bucks. Well, guess what? That's a big 10 or 12 dollars monthly when you're talking right now.
Yeah, Jeremy, speaking of some giveaway things, one of the plans out there, they actually give you a card that they put money on that card to help pay for your co-pays and co-insurances. There's another plan out there on your card. When you go shopping, they actually put money on that card to help pay for vitamins, cough drops, Band-Aids, toothpaste, toothbrushes, and you actually pay for it with your health insurance card. I know that's a weird concept, but that's how they're changing everything digital. It's pretty cool. They also do a pretty cool thing too, where if you go see your doctor, they actually give you money on your health insurance card. If you get your bill paperless, they give you money. Yeah, if you walk so many steps, if you exercise, they give you money on your card. So when you go grocery shopping, you actually can use your card to help pay for some of those bills. It's pretty cool.
Tim Jopp, the Medicare man, is our guest. You know, we've done so many spots over the years, and open enrollment runs now through December 7th or October 15th through December 7th. But we've done spots before. We call it this oopsie time.
Yeah.
What is the oopsie time? Is that if people don't get what they need to get done between now and December 7th?
Yeah. So now and December 7th, you can change your plan or you can change your mind as much as you want. Whatever plan you sign up for last is the plan you're going to end up with January 1st. But the oopsie time is the first quarter of the year, January 1st through March 31st. And those are the months where, listen, I didn't change. I should have changed. I changed and I don't like my plan. I want to go back to my old one. You can do that one time during the first quarter. Now, there's also another time throughout the year. There are some companies that have what's called 5-star rated companies. If there's a 5-star, which is the highest rating you can get by the government for the insurance company, you can also change that plan or into that plan once a year, anytime throughout the year. But the oopsie time is that first quarter. Don't like it. Wish I would have done something different. You can change one time.
Medical or Medicare disclaimers. What's that all about?
Yeah, so
in a quick minute, I suppose.
Yeah, I'll make this one really quick. So the government this last year, they're seeing a lot of complaints from people switching plans to the plans they don't want to switch to. So the government's now making us read a disclaimer. So every time you talk to somebody, we're hoping a local agent, you need to be told a disclaimer on how that they don't sell every single product in your area. You've got to call the government if you want to find out something else.
All right. Hey, Tim, we're just about out of time. Is there anything we've left out that you want to discuss or maybe just plug those seminars one more time?
Yeah, so the seminars are a good thing. The big thing I want to get across, I do this all the time, talk to your local agent. Again, I'd love it if you worked with me, but you don't have to. Work with somebody local. They know the pulse. They know what's going on here. They understand the plans. They're not just trying to sell you something.
And I think the best thing when you're working with a local agent, I can call you up on the phone or I can call my local agent up on the phone. It's not an 800 number. I'm not getting Debbie, Donna, and who else every other time that I call. It's specifically designed and catered to you, right?
Yeah, and that's what Elroy loves to say.
Yeah. If you don't know where their building is, you don't know where their office is, don't use them. Use a local person at all times. This 1-800 number is not good.
Hey, Tim, it's always great having you here on Norwood Young America Talk. Thanks for the valuable information, and we'll talk to you again soon. And don't overwork yourself these next few months, all right?
Thanks for having me, guys.
Yep. We're going to take one final break. You listen to NYA Talk right here in Class C Country, AM 1310 and FM 96.1 KGLB. Be right back.